within Kent County. So she takes me to the county doctor, and he examines me, and he prescribes brewer's yeast and some other things that I should be taking, you know. And my mother always fed me well. She ran a rooming house. She fed me well, but I was a skinny kid, you know. Mm-hmm. Well, the fact that I could, in the height of the Depression, be seen by the county surgeon general for Kent County, right, and have him make recommendations which my mother could then afford. Mm-hmm. I mean, I couldn't understand why we can't have that now.
Right. Prevention is always cheaper than treatment.
Yes.
Right.
Prevention. Mm-hmm. Some foresight. Mm-hmm. Some looking ahead to those things that we can do in terms of our actions and in terms of our diet, right, that can make us better, healthier people. Mm-hmm. Now, in terms of universal health care, single-payer universal health care, what's the difference between universal health care and single-payer universal health care?
Jason.
Well, I guess there's a lot of different plans going out there. Actually, the two we were talking about most last night, and I think the two that are most on the table right now, or rather, that are most talked about, one is the single payer and the other is a public option.
Yes.
Single payer is what most people think of when they hear universal health care, as in the government pays for the health coverage of everybody, and they do that by collecting taxes from us to pay for it.
Yes.
And the benefit of that primarily is when you have one place paying for all of it, then they can keep the costs controlled, keep the costs lower. And also there's studies that look at the fact that government health insurance administrative costs are significantly lower. One figure we saw saying that it was up to 10 times lower than administrative costs for a private insurance company. On the other hand, the public option healthcare plan, which is the one that's actually got President Obama's support right now, is where the government provides a health insurance plan that people can buy into if they choose to. Mm-hmm. And then the government would subsidize it for those people who couldn't afford to buy into it on their own. Mm-hmm. It would be, from the private insurance company's perspective, in competition with private insurance, but the goal would be that the public option would be to pick up everybody who couldn't get insurance through the private industry.
So the idea is still universal health care.
Yeah.
But some of it would be private and some of it would be public. Is that right?
Yeah.
Yeah. Oh,
having the choice is so important, because then it would create the private insurance companies to become more efficient, and becoming more efficient, then that they'll have to, you know, being in competition is always a good thing. And isn't that what America is all about? We're always about, you know, having enough options so that there can be competition. And I just think that's a start. I think if we start with the public option, and then eventually people will see that, you know, single payer is the way to go, because then everybody is cared for.
You know, as a matter of fact, there are several things at stake here, isn't there? One is we want health care, but we really want health care for everyone. Now, there are different ways in which we could have health care for everyone. Mm-hmm. One might be a universal single-payer program, where it's really all under the administration of the government. Mm-hmm. The other would be where you'd have your choice. You know, maybe your company will provide you with some money along with your salary, that you can purchase your own. See? Okay, that's fine. But maybe your company, the one that you work for, is not big enough or equipped enough to do that, mm-hmm, or chooses not to do it. Still, everybody, every citizen in this country, with their children, have the opportunity to have health care.
Right. And have the opportunity. That is important, because that's why America was founded, was giving us all the opportunity for freedoms of, you know, choices and that. And so It just seems so American to me.
Okay, well, I understand that. You know, my father immigrated from Sweden. You know, I'm named after my Swedish grandfather, Franz Gustav Nilsson. But of course, Ellis Island never got it right, so I became Nelson, or he became Nelson instead of Nilsson, you see. But he worked for some Swedish farmers around Galesburg, Illinois, and then later worked for a construction firm out on the West Coast. He eventually worked for a construction firm in Grand Rapids, Michigan, where he met my mother. See, they got married and had me, 1927. But he brought a bad old country habit of drinking on the weekends. He worked 5.5 days a week, you see. He worked half day on Saturday, he'd come home, and then he'd get into his Model T Ford. And he told me once, I felt just like a prince. Well, that's fine, except the prince went drinking with his buddies, you know, on the weekend. And finally, after 2 years of that, my mother had enough of it, and she divorced him. See? So we always lived together in the same neighborhood. We knew each other, we were in cordial relations, but she wouldn't put up with that nonsense of drinking every weekend. Now, there are things that we can do to improve our health, you see. We don't, I mean, part of it's a matter of rules and regulations. I was interested that the Obama administration is now trying to do something in terms of alcohol and drinking, isn't it? Yes. So it hasn't gotten as far as to ban
cigarette
drinking.
smoking.
And cigarette smoking, exactly. And cigarettes, you see, let the people really see what they're getting into and try to do whatever we can to keep them from getting started in school.
Prevention, Frank.
Yes, yes.
Yeah.
So what are some of your thoughts about this in regard to health care? What could we start with right now to have a better system for the overall health of the American public?
Well, I mean, one thing, the biggest reason I had the house party last night was to begin conversation and asking everyone who came to please contact 5 friends and family members, and then those 5 contact 5 more. And then just like the whole grassroots campaign that happened with you know, getting our president.
Yes.
I think people don't realize just, you know, not only the importance, but how easy it can be to just, you know, learn a little bit about the public option, the single payer option, and spread that to 5 other people and say, can you spread this? You know, because that is what creates momentum and changes our country, just
and
like
finally,
getting our president.
Who are the people that have the power to change our country and its policies? Who?
We the people.
We the people.
And that's the other thing that people forget about, is that they are so concerned about the government having too much control over their lives, but they forget that we are the government, we the people.
Yes.
It's what? For the people, by the people, of the people. We the people are supposed to be the government, right?
Exactly.
And when we have congressmen in there who are not representing us, then we need to
change it.
Right. We
Speak up and tell them what we want.
And tell them what we want,
we do have a voice.
and say that you need to be thinking of us, not these private companies who are supporting you. And that's where we need to change.
How did you get involved in this debate?
In a formal way.
Well,
to
yes,
be here,
or I mean,
this is something that you know, I've talked about with friends and family for a long time, and just, you know, Liz is always out there championing all the important causes, and we got involved with the Yamhill County Democrats during the Obama campaign.
Yes.
But the great thing about that is, even then, you know, it wasn't just about making Obama president. It was about everybody getting together and remembering that we do have a voice and we can stand up and say what we want. We can do it through voting. We can do it through calling or writing to our representatives. We can do it by some people going out and marching out to where the representatives are, just so their faces can be seen, however it is. that awareness, that realization that what we say really does matter, really struck me when you